Hi, I'm Dr. Bruce Semon, and I want to demonstrate the best way to prepare homeopathic remedies to take them for the best effectiveness. Remedies come in bottles like this. They are little sugar balls. These are lactose balls, and they are what contain the remedy. And what you do is you start with 2 of them, and you put them into a cup of water. This is half full of a filtered water or purified water or distilled water. And what you do next is to stir this for about 30 seconds. Okay, now I have stirred the remedy. The little balls do not need to completely dissolve, just partially dissolve. And I'm going to take out 1 spoonful and put it into a cup which at the moment contains only water. And I'm going to stir this now again for another 30 seconds. Now I have stirred the remedy in the 2nd cup for 30 seconds. And now this remedy is ready for the taking. And now what I would do, if this remedy were the remedy that I would want to take, I would simply take 1 spoonful. Now, an alternative to using the 2-cup method is to take an old medicine bottle like this and put the remedy directly in here. Another way to do it is to take a bottle like this or any other plastic bottle you may have and pour the 1st cup containing the remedy or containing the little balls the little sugar balls that you had, and pour it into the old medicine bottle.
Dr. Semon, I have a question. Sometimes do you give your patients the remedies already in the medicine bottle, which of course is not old and used, it's clean, correct?
The bottle is clean.
And sometimes you give your patients the remedy in the medicine bottle, correct?
That is correct.
And then what do they do with the remedy that is already in the medicine bottle?
Then they would simply fill the bottle with distilled water or some kind of purified water.
And then what would they do with the remedy after they fill the bottle?
Then what they would do is simply shake it a little bit, again for about 30 seconds, and take out a spoonful, like we did from the 1st cup, and then they would put it into the next cup.
And that cup just has plain water in it?
That cup has plain water in it.
And they mix it up?
And then they would mix it up, and again, they would take this. After stirring, this would be their dose of the remedy, this spoonful from the cup.
Okay. What do they do with the water in the yellow cup after they have finished the remedy?
The 2nd cup that they actually took the remedy from, they can discard this.
Okay. And what do they do with the remedy that's in the bottle?
If either from the bottle, wherever you put the remedy, the actual little sugar balls, either this one or the 1st one, you save in the refrigerator.
Okay. And how long do they last?
Well, we've kept them for a long time, up to several months.
Okay. Thank you, Dr. Semon. This will be very helpful for your patients.
Oh, we have more.
Dr. Semon, this method that you have shown us is really for the first time somebody takes the remedy.
That is correct.
So what happens if they have to take another dose of the remedy?
If they have to take another dose of the remedy, first, as long as the remedy is helpful, you do not repeat the dose. This is not like taking it every day like other medicines are. As long as the remedy is helpful, you continue without taking another dose of the remedy. But if the remedy starts to wear off, and certainly this is the case if you're treating an autistic child, you have to know how to handle the next dose of the remedy.
Okay, so what do you do?
What you do is, it's easiest again in these bottles, these plastic bottles, is to hit the remedy like this, twice or maybe 3 times, and then you just shake it a little bit, and again you take out 1 spoonful and put it into a cup half full of purified water that does not have anything else in it, and again you stir. And then this is the remedy that you take, like this. And again, after that happens, this is thrown out, and you keep your bottle. Or if you do that in the 1st cup, you can do it this way. It's just a little harder to do. you keep these where the remedy was first originally put.
Okay. And is there anything more that your patients need to know?
Well, sometimes remedies can last a long time. You don't need to repeat them. In autism, we find remedies need to be repeated about every 3 to 5 days, and sometimes they need to be alternated and you use 2 different remedies. But these are the basic principles for dissolving in water.
Okay. And if your patients have questions, should they contact you?
They can contact me.
Thank you very much, Dr. Semon. Bye-bye.
Thank you. Bye.